Wagyu Khalsa, Wagyu Ki Fateh. Give it a welcome to the Kiran Rai Show. I hope you guys have been keeping well and keeping safe. It's always lovely to come and speak to you guys every Thursday at 9:30. Now, अगले हफ्ते से गल कर रहे सीगे about women and fertility, because we often find that in our communities this is a topic that many people feel embarrassed about or may not feel comfortable talking about, don't know where to go to get the help from, or ਕਿਹਨੂੰ ਜਾਣ ਕਿਹਦੇ ਨਾਲ ਗੱਲ ਕਰਨੀ ਆ। ਕਈ ਵਾਰੀ ਘਰ ਵਾਲਿਆਂ ਨਾਲ ਨਹੀਂ ਗੱਲ ਹੁੰਦੀ ਹੈਗੀ, ਕਈ ਵਾਰੀ ਆਪਣੇ ਪਾਰਟਨਰਸ ਦੇ ਨਾਲ ਨਹੀਂ ਗੱਲ ਹੁੰਦੀ ਹੈਗੀ। So often people kind of struggle to kind of get the right help that they actually need. And last week we were talking with Dr. Pavan, and I'm so excited that Dr. Pavan is with us back this week again. Dr. Pavan, welcome back to the show. I'm so excited to have you. We've got so much to talk about. How are you?
I'm really well, thank you. Thanks for having me again.
That's good. That's good. So, last week we touched base about so many different things about women and their fertility. So one of the other questions that many people want to know is, a lot of people experience they experience pain, they experience problems, like for example Vulvodynia and other health conditions. People that go through these health conditions, can people, what kind of condition are there? What types of conditions are these, and what causes them? Is there any help to kind of fix and resolve these issues that they have?
Yeah, so I mean, again, with anything and everything, if you have a problem and you're not sure what's going on with your body, then again, I would really always encourage you to go out and see your GP and discuss it with them further, so that you can try and get a diagnosis of what might be causing it. And also, if it's affecting your quality of life, then seeking that help may really help to improve your quality of life. It's also good for your mental health and well-being to discuss things that are worrying you and concerning you. And then, as we were talking last week about fertility and trying to get pregnant, seeking the right help at the right time can also facilitate that as well. Specifically conditions related to pain, you mentioned vulvodynia, which is having pain in the female genital area and the vulval area, which is related to sort of the nerves being stimulated. So people may experience like a burning pain or a stinging sensation. This sort of falls under the sort of psychosexual health bracket, as does a condition called vaginismus, which is when the muscles of the vagina clench, making that intimacy which is required for naturally making a baby difficult. So there is definitely help available. Firstly, see your doctor, your GP. Discuss it openly. There's nothing to be ashamed of. So many women honestly go through this, and probably far more than the statistics even show, because there's probably many, many more women out there who don't seek the help because they're too embarrassed to. But there's nothing to feel embarrassed about. Your GPs are there to help you. As hospital doctors are there to help you, to listen, and just to make things better for you. So nothing's ever, too much. Don't think that, oh, I'm just getting some pain down there, that must be normal, I can't function properly and it's affecting my quality of life, but I don't want to go and bother the doctor, they're going to think I'm silly, that there's nothing wrong with me, I'm embarrassed to talk about it. You should never feel that way. We're there to listen, and that is our primary aim, to listen and to help you have a better quality of life and achieve all the things that you want to achieve in terms of fertility, etc.
And I was reading something about it actually, that drinking a lot of water, especially drinking 2 liters of water, actually helps you. It cleans out your system. It, even our brain. Most of all, when we're functioning, if we don't have enough water, our brain doesn't actually function really well. So it's just important for our whole body, isn't it? Especially when people that are suffering with so much pain and things like that, they end up having water infections and things like that, and it can turn into a kidney infection or anything like that. And it all starts from not drinking enough water, doesn't it?
Yeah, I mean, having good volumes of water is good for your overall health and functioning of your body. I don't know that it's specifically going to cause problems with if we're going back to fertility specifically, that it's going to cause problems with with that. But for your overall health and well-being, and it's always good to drink plenty of water, and make sure you're taking your vitamin D. If you're trying to get pregnant, make sure you're taking folic acid at least 3 months ideally before you get pregnant, up until 3 months of pregnancy. Having a healthy balanced lifestyle, eating the right foods in moderation, having the unhealthy foods that you enjoy eating as well, because it's all balance, isn't it? And then exercise as well, because getting your body in the best shape it can be will be beneficial to your mental and physical well-being.
And of course, and I know this is going a bit off topic, but we believe that, it's a really good example, isn't it, that you've just touched base on food. When we in the morning, if you have a bag of crisps, it makes you start with being really sluggish, start to your day. Whereas if you had, a glass of water, or an apple to the day, they say an apple a day keeps the doctor away. We've all heard that saying, haven't we? So, it depends, doesn't it, on your actual diet? Because जैसे apple दिन ਦੇ ਵਿੱਚ ਸਵੇਰ ਨੂੰ ਉੱਠ ਕੇ apple ਖਾਈਏ, it definitely doctor ਤੋਂ ਦੂਰ ਹੀ ਰਹਿਣਾ because we definitely look after our health really well, don't we? And ਆਪਾਂ ਜੇ ਸਵੇਰ ਨੂੰ ਉੱਠ ਕੇ ਪਾਣੀ ਦਾ glass ਠੰਡਾ ਪੀਏ, that definitely refreshes us, doesn't it? Instead of actually ਉੱਠ ਕੇ, because ਪਹਿਲੇ ਜਿਹੜੇ ਦੇਸੀ ਹੁੰਦੇ ਉੱਠ ਕੇ ਪਹਿਲਾਂ ਕਹਿੰਦੇ ਹੁੰਦੇ ਆ ਸਵੇਰ ਤੋਂ ਪਹਿਲਾਂ ਚਾਹ ਦਾ ਕੱਪ ਪੀਂਦੇ ਆ, ਫਿਰ ਥੋੜੀ ਜਾਗ ਆਣੀ ਹੈ body ਦੇ ਵਿੱਚ. But if we definitely look after our health, and if we save that khayal rakhiye, then it definitely has so many effects, not just on our fertility side, but also our mental well-being, doesn't it? And in terms of, we talked about obviously diet, and is there certain foods or any elements that a person should be eating if they're trying?
Not particularly. It just comes back down to healthy, balanced diet. And that is probably one of the questions that I'm asked most frequently. Like, what should I eat? What will help me get pregnant? Are there certain foods that will help me? There isn't really. What's going to help you get pregnant is having that healthy, balanced diet, is exercising and keeping your weight to height ratio and your BMI in the healthy range. What I know is people who are very underweight may have problems getting pregnant because they're not really seeing their periods, they're not ovulating or releasing an egg, because they're very underweight. So your brain isn't releasing the right hormones to stimulate ovulation. And on the other end of the spectrum, we know that being overweight can cause your periods to become very irregular as well. And that in itself also will affect your fertility. So that's why it's important to do everything you can to be as healthy as you can.
So in that case, it's quite interesting, Dr. Pavan, because, we're talking about obviously, the factors of eating healthy, being healthy, trying to keep that positive mind frame. And, even, being oversized weight or having, not being in the right size, like they say, even way it's a struggle for both ends of the spectrum, right? So how does, someone that's obviously struggling with their weight, they may have other health conditions, for example, diabetes or anything like that. People like that have got, underlying health conditions. How is it for them? How can they kind of get the right health? Because I, for example, I struggle to put weight on. I lose it very quickly, especially when I'm stressed. I will lose the weight very quickly. And I'm sure many people that are watching, if they're stressed out, they'll, eat a lot more because they're stress eating. Or there's a lot of people that, will lose the weight because they're very stressed. So people that are under stress or anything like that, does that also add to the factor of they're trying to get, if they're trying to conceive, it makes it difficult more for them?
I mean, stress in itself definitely can, because again, it can stop those hormones from being released that you need to help ovulation and for an egg to be released, so that it can be fertilized and so that you can get pregnant. So stress is a sort of independent factor, and then being overweight or underweight can also contribute to it as well. But again, don't just think that, oh, because I'm underweight or because I'm overweight, that's it, there's no help now. Unless I can just lose weight or gain weight, there's no point me seeing anyone, because there's nothing that they're going to be able to do. That isn't the case. So if you are, if you're trying to get within a healthy weight range, and you're struggling with that, then again, you need to seek the appropriate help, because there is help out there. You can be referred to a dietitian who can go through your diet with you, can look at what your intake is, where you can add more nutritious and healthier alternatives, where, if you're underweight, where you can increase your calorie intake and how you can do that. And also sort of I don't know what the specific programs are, but they're sort of these live well, be well sort of, or be well, live well programs that GPs can refer you to as well. And there's other things like weight loss programs, again, that the GP can advise you on, or you can just have a look at the NHS website and have a look at what's closest to you in your area and where you can go.
So for all my
it's not it's not possible for everyone to go to the gym. They may not have the financial stability to be able to afford a monthly gym membership. So there's free help out there as well.
And for all my viewers that are actually watching, that's a really good point to take from Dr. Pavan. There is help out there. Help हैगी है जो तुसी अपने डॉक्टर को जाओगे. It's only going to take one phone call. तुसी एक फोन करोगे अपने डॉक्टर के नाल अपॉइंटमेंट बना के उन्हां नाल गलबात करो जो भी प्रॉब्लम हैगी है, and the help is there, the support is there, because NHS राही काफी कुछ हेल्प मिल जाती है. हाँ, कई बारी वेट करनी पैंदी है सानू, पर साडी सेहत ਲਈ mentally, physically and emotionally, and to better our lives, we just need to make that one step and that one phone call. And often we were saying, weren't we, that sometimes we just need that one push, don't we? Just a little push to get that right help that we actually need, because some people will sit there and suffer with silence and not say a thing about it. But in actual fact, people don't need to know. If you want to ring the doctor to get the help, not everyone in your family, you don't need to discuss it with anyone. You can go in your car, be on the way, I don't suggest to drive and call the doctor, but make sure you're parked up and then you're asking for help. But you can get the help that you don't need to discuss it with anybody else. And of course, Dr. Pavan, we also touched base last week about with people, especially with the older generation, ਕਹਿੰਦੇ ਆ ਕਿ ਹਲਦੀ ਨੂੰ ਦੁੱਧ ਵਿੱਚ ਮਿਕਸ ਕਰਕੇ ਪੀਵੋ ਜਾਂ ਏਦਾਂ ਕਰੋ, ਆ ਦੇਸੀ ਦਵਾ ਖਾ ਲਓ, ਇਹਦੇ ਨਾਲ ਫਰਕ ਪੈ ਜਾਊਗਾ ਜਾਂ ਇਹਦੇ ਨਾਲ ਹੋ ਜਾਊਗਾ. No desi dua helps, does it, to help a person conceive or have the baby that they actually want? That's true, isn't it?
Yeah, so if we're going by evidence-based medicine, which is what we as doctors would always go by, there's no evidence that actually that's going to help. But what we do know is that leading a healthy lifestyle and optimizing your health will help you in many ways. So those are old wives' tales, and you can always try them. There's no harm, but don't let it delay you actually seeking medical help either. So try it. If it works for you, then that is fantastic. It's great. But if you're worried, then you should also be seeing a doctor as well, so that we can investigate further, come to a diagnosis, and offer you various appropriate treatment options, and then you can decide whether those are appropriate for you and whether you're willing and wanting to go with those management plans, or whether you say thank you for advising me on X, Y, and Z, but actually I want to just carry on with what I'm doing because I'm happy with that. That's okay, but at least give yourself the opportunity to know what help is available so that you can make that informed choice and decision.
And for everyone that's watching, please do take this away. There's no pressure that, actually this needs to happen or that needs to happen. The NHS that are there to kind of help, get the best of what we need in our lives. And Dr. Pavan, talking about, conceiving and, having that fertility and getting the help that we need. There's people out there and there's women out there that, of course, probably suffered, and we touched base on it a tiny bit last week, that will probably suffer with miscarriage. When people suffer with women that do, suffer with miscarriage, how does that happen? Like, what causes those miscarriages? Because we see often early stages, they may not have told everyone about it, and it happens to them, and it often it's a very sad sorrow feeling for that person. It's almost like something's died in them. and it happens, when it happens to the woman, it also affects the male as well. What are the causes of that, and why does it make them feel so sad and sorry, like if something's died in part of them?
Yeah, so I mean, firstly, if anyone watching this is in that situation and they have either gone through a miscarriage or are going through a miscarriage or loss of their baby, then I'm really, really sorry that that's happened to you. It's really difficult to go through, and it's really difficult to get your head around why it's happened. From polls and things that I've done on social media, and from what I've learnt from women, is that people feel like their bodies have let them down, like they're a failure, like they've done something wrong, and they feel really
Mm,
embarrassed, shamed. I mean, lots of us have been in that situation and can relate to those emotions. You have that positive pregnancy test and you've planned so many years far in advance. You've already planned what you're going to do for that baby's first birthday, second birthday, what school they're going to go to. Lots of us do plan that far ahead when you see that positive pregnancy test.
mm,
So to then have a miscarriage is so devastating, because not only do you need to come to terms with that, but those dreams that you had for that pregnancy, you need to get your head around that ending as well, and that can be exceptionally difficult. Um,
mm,
there's lots of support groups out there to help with that. So that's what I really want to say right at the start, because this can be a very sort of triggering topic for lots of people, and they may not feel comfortable with listening further about the
mm,
topic. On the other hand, they may want to hear lots more, and that's great if they do as well. But I would encourage you to look at information and support networks such as the Miscarriage Association. You can just Google it or put it in your search
mm,
engine, and that will direct you there. And they have helplines as well. And there's Tommy's as well, and they have lots of support available from people, couples who have gone through miscarriage, as well as, not just the woman, but also the man as well.
mm,
What exactly causes miscarriage isn't fully understood, so we don't know exactly why miscarriage happens. But what we think is that most miscarriages are likely to be because of a chromosomal problem, like a genetic problem, which has ended in the pregnancy just ending itself rather than continuing.
mm.
So most miscarriages are likely to be because of that. It's very common. It affects around 1 in 4 to 5 pregnancies. Um, but even after one miscarriage, your chance of getting pregnant and having what we call, a successful pregnancy, a pregnancy that's going to be ongoing,
Yeah.
is very, very high. And having one miscarriage doesn't mean that you're going to have a miscarriage next time. Your chance of having a miscarriage is still around the same as a background chance, which is
Mm,
about 1 in 5. However, if you have what we call recurrent miscarriage, which is miscarriage after miscarriage after miscarriage, and you have 3 of those in a row without any
mm,
ongoing pregnancies in between, then your chance of having a further miscarriage is higher. And that's why on the NHS, we investigate that further after 3 recurrent miscarriages. So
mm,
your GP should refer you to what we call a recurrent miscarriage clinic, where they'll do lots of investigations and blood tests to see if there's any underlying issues that are causing that recurrence and those frequent miscarriages. So that's what we currently do on sort of in the NHS investigation and treatment plan for miscarriage.
and
Um, yeah,
I was going to say that with people, of course, that go through, and of course, it's really hard, this topic that we're discussing right now. Many of you that are probably watching right now probably gone through it or going through it. It is very hard, I guess, but there is light at the end of the tunnel. And people that do have, I was going to say, one of the questions, and I think you've already answered it, that women that do go through miscarriages, does it stop the chances of conceiving? But actually, it doesn't, and a lot of people feel like it does, doesn't it? For them, it's like a dead end for them, doesn't it?
yeah, but because it's devastating, isn't it? You think that it's happened once. What if it happens again? And you take that anxiety into any future pregnancies, and you know,
Mm,
unless you seek the right help emotionally to come to terms with what's happened, taking that all that with you onto your next pregnancy can make that a really sort of anxious pregnancy, an anxious time for you. And I've seen it. I've seen through women who have gone through baby loss in the early stages, which we refer to as miscarriage, later miscarriages and sort of mid-trimester miscarriages, and also people who have had lost their babies in the third trimester and had stillborn babies. It's absolutely devastating unless you seek the right help to overcome everything you're going through. Then you might take that with you in the future pregnancies, and that can have quite a negative impact on your mental health and well-being. And also the other thing is that, there's this thing that people think that, oh, it was just a miscarriage, and that's less significant than any other kind of baby loss. And it's similar to ectopic pregnancy, which is when a pregnancy implants outside of the womb. So most commonly it's in the called the fallopian tubes, which is, the fallopian tubes, as I mentioned previously, they're the tubes that collect an egg from the ovary when the egg's released. The egg travels along the fallopian tube, and then a sperm meets it along its way, and the egg fertilizes, and then that's what the baby grows from. But it should move back down along the tube into the womb, and that's where the pregnancy should implant. If that pregnancy implants outside the womb, it's an ectopic pregnancy, and that's a dangerous pregnancy because that pregnancy can cause the tube to burst, for example, and cause internal bleeding for the mother, and it can be really, really dangerous. But again, it's dangerous, but it's also baby loss and pregnancy loss for that and that couple going through it, and that's really important to recognize. And we shouldn't just think, oh, it was just an ectopic pregnancy or it was just a miscarriage, so that it's less relevant than any other kind of pregnancy loss or baby loss. It's very relevant to that couple going through it. So if your friends or family have been through that, take the time to listen and see if they need your help and support and your ears, just to listen to them and see how they're feeling. And if they don't want to talk about it, then that's fine as well. But just be there for them, and don't just think that it wasn't a big deal, it was just a miscarriage, because it's never just a miscarriage. There's people who are really going through a difficult time.
And it's not. It's often it's inna zaruri nahi hunda hai. And I wonder if you agree with this, Dr. Pavan. Just being there for someone, it doesn't mean that you have to sit there and puchi jana ki hoya si, because we see it. Even with our mother-in-laws, we see it with them as well, don't we? That they'll often keep probing ki hoya gal nahi kar de. You don't need to do that. All you need is just someone to just bring you a cup of tea or orange juice or a glass of water and just kind of sit there and just listen, right? And just be there just like that. When they feel comfortable to talk to you, they'll actually come and talk to you about it. I mean, even like Dr. Pubman, just very quickly before we come towards the end of the show, just to touch base, people that of course suffer with, diabetes or anything like that, is it hard for them to kind of, get pregnant and have a baby because they've had a really hard diabetes? And it's obviously been a struggle for them in their life. So is it really hard that they can actually conceive or not conceive?
So poorly controlled diabetes can make it more difficult to conceive. But also you need to think about underlying health conditions and how they can affect pregnancy. So if you are a diabetic, or if you're an epileptic, or if you've got, Crohn's disease, ulcerative colitis, or any underlying medical problems, then ideally, when you start thinking that I want to have a family or I want to get pregnant in the next, year or so, or next few months, if you're on any regular medication for underlying health conditions, I would always advise you to see your doctor before getting pregnant, so that they can look up all the medications you're taking, including if you have any mental health problems and you're taking any medications for that. Don't just stop taking your medicine. Please go and see your doctor first. Let them know that I'm thinking about getting pregnant. They can have a look at all the medications you're taking, check that they're safe to take in pregnancy and when trying to conceive. If they're not, then they can look at alternative regimes for you in a safe way, rather than abruptly stopping any medications. And also looking at your overall health. They can help you to optimize your overall health before you get pregnant, because going into pregnancy as a high risk pregnancy with very poorly controlled diabetes, or someone who's having lots of epileptic seizures quite frequently, or someone who's having lots of flare-ups of their bowel disorder, it can make it a higher risk pregnancy. So it's better to have those conditions under control before you get pregnant, to keep both you and your baby as safe and healthy as possible throughout the duration of your pregnancy and when they're born.
And of course, if it's not controlled, it causes complications, doesn't it, further down the line, not just for yourself, but also for your baby whilst you're trying to carry that baby. That's right, isn't it, Dr. Pavan?
Yeah, I mean, it depends on exactly what health condition you have, but it can affect the health of the baby. We know that, poorly controlled diabetes, for example, can cause problems with babies' growth. They can be, very, very big babies, which can be a problem. They can increase your complications or potential complications in the birthing process as well. And unfortunately, poorly controlled diabetes is also associated with a higher chance of having a stillborn baby, and that's why it's so very important. If you're a diabetic and you get pregnant, you will be under a specialist consultant obstetrician, and a diabetic specialist and a diabetic midwife as well, and they will review you and monitor your pregnancy, your blood sugar levels, your medications, and your baby throughout the course of your pregnancy. And that's what we do for other health conditions as well that are underlying, such as epilepsy, as I mentioned. So yeah, it's what we call multidisciplinary care, where you're looked after by a team of specialists so that we can really, as I say, keep you and your baby safe and give you a nice pregnancy journey.
Thank you, Dr. And thank you, Dr. Pavan, for actually coming on. It's really helpful to have you on, and we don't know who we've actually helped today. So everything that you've said, really, really do appreciate your time coming on today. Now, everyone that's been watching the show, I hope you guys have enjoyed this topic and took something away from it. And maybe, if you need that extra push to just call the doctor and you feel like you can't do it with any, people need to know. No one needs to know. You just need to, you can do it in your own time, and call when you're in a car or when you're, when you're by yourself. It doesn't have to be that everyone needs to know about that you've took the first step. But you do go get the help that you actually do need. Dr. Pavan, thank you so much for coming on to today's show, and it's lovely having you on. And today, why could you go? Oh my god, that was so